Welcome to Friday, the last day of TechNet. When I arrived at about 8:15 with 3 people in the room, I wondered what you all got up to last night. Maybe we can discuss that later, but it's great that the TechNet Conference is coming to an end, not because we will be happy to leave our friends, but because we want to put into action all of the knowledge that we've learnt. We want to follow up with the contacts that we've had. And that brings us to today's session, where we're going to really be able to have a look at and understand what's happening in the international environment, these broader programs and initiatives that we can interact with at a country level. What I would like you to think about as these presentations are coming forward is what this means for you at the country level. How can what you hear today help you take action at the country level? And I would like you to think about that as you prepare some questions that we'll have later this morning. So just one moment. So you have your updated programs before you. And we have a wealth of presentations to get through. So first of all, I'd like to introduce you to Debra Kristensen from PATH. She'll be our first speaker this morning. She's the director of the Vaccine Pharmaceutical Technologies section in PATH. And this section looks at formulation, stabilization, technologies, packaging, supply systems, and equipment. She also represents PATH in IPAC and chairs VPPAG. And so with that, I'd like to welcome Debra. Please join with me in thanking her. For waking up this morning.
Good morning. I'm pleased to be here to represent the Vaccine Presentation and Packaging Advisory Group, or the VPPAG. And we've been talking a great deal this week about improving supply chains, but I'd like to move us into a slightly different mindset now, one where we consider how we can improve the vaccine products themselves so that they flow better through the supply chain, and so they have inherent features that help to ease logistics and help us to reach the unreached. And I can't begin to tell you how fantastic it is for me to work on the VPPAG and to work hand in hand with industry on these issues, something that didn't happen when I began working in this field a few decades ago. So the VPPAG serves as a really unique forum for industry and the public sector to work together towards achieving these types of product improvements. In the process, the public sector is able to sensitize industry to their programmatic needs and operational constraints, and industry is able to sensitize the public sector to their technical constraints and their economic realities. And this is the list of current VPPAG members. We're really lucky here at this TechNet meeting. We have 11 of the members present at the meeting. And I'd like to point out in particular that WHO and UNICEF are the conveners of the VPPAG. So they have committed to the financial resources and the secretariat function to help to sustain this group. So the VPPAG works to improve vaccine products through a number of mechanisms. For example, we have working groups to advance specific topics, such as the barcode working group. We develop consensus recommendations that are normally translated into the generic preferred product profile recommendations for vaccines, the document you see here. We're also able to hold bilateral consultations with industry about specific presentation and packaging issues that they might have, and sometimes help them work through trade-offs and provide the feedback from the public sector. And we also serve as a subcommittee of IPAC. For example, at times IPAC needs feedback from industry, and so they'll work with the VPPAG to obtain that feedback on specific issues. And VPPAG will work with our IFPMA and our DCVMN members to obtain feedback from the industrialized and developing country vaccine manufacturers. So there's basically 3 ways that VPPAG mechanisms can create impact. The first is that They might be adopted by WHO into the pre-qualification process, and the mechanism for that is the programmatic suitability of vaccine candidates for pre-qualification function, and we call this the PSPQ, so that's one way. The other is that they might become part of another WHO recommendation or guideline. And the third is that vaccine manufacturers might choose to independently adopt VPAG recommendations. So now I'm going to give you quickly an example of each of these mechanisms. So a number of VPAG recommendations have already been included in WHO's PSPQ, and they're shown here. These include recommendations around maximum pack volumes for vaccines, recommendations on doses per primary container, and recommendations on packaging materials. And one set of VPAG recommendations is also becoming part of WHO guidance, and these are recommendations on the content on the primary container for vaccine, on the primary vaccine container label. These recommendations were subsequently endorsed by the IPAC and the ECBS, and now WHO is incorporating them into their technical report series. And the impetus behind all this is that there were issues in countries with legibility on the primary container labels. The font was getting so small, there was so much information. So we worked to really identify what are the basic needs for the primary container label that will meet regulatory requirements, that will meet vaccine manufacturer requirements, but will allow us to move to standardized content in a larger font size. So the final example is that of industry directly adopting a recommendation. And of course, the VPAG has been promoting minimization of primary container volumes for some time, and a number of vaccine manufacturers have actually moved in this direction on their own, and 3 examples are shown here. And this is a trend that we continue to encourage, and one that I'm sure that this audience greatly appreciates. So as I mentioned earlier, we recently updated the generic preferred product profile for vaccines. This slide gives you an idea of the type of content that's in there. And there are two areas actually, packaging around volumes and barcoding that I'm just going to highlight quickly now. So under Andrew Garnett's leadership, the VPAG developed some very specific guidance for vial and packaging sizes for future vaccines. And these recommendations were developed in collaboration with industry, and they are also based around ISO standards. And the hope is that they will be reflected in WHO's international guidelines for packaging and shipping, and perhaps updates to the PSPQ. So obviously, the intent is to reduce cold chain volumes, but Andrew's work went well beyond this. He worked towards harmonization of the vial sizes and secondary packaging sizes to help ensure that the future products would have dimensions that actually fit better into cold chain equipment. And I just can't begin to tell you the level of detailed analysis that he went through and the discussions with industry that he took to reach consensus on these recommendations. It was really a huge accomplishment. And our barcoding working group is currently led by Rich Hollander and Caleb Brownlow. And this group benefits from very active involvement by GS1, the barcode standard organization, and by industry. And recommendations have already been made on barcoding content for secondary and tertiary packaging. And again, these are reflected in the generic preferred product profile. So as you heard in the data for management working group or sessions yesterday, there's already been work in Pakistan and Tanzania with vaccine producers, and they've placed barcodes on packaging and already beginning to implement that in a few countries. And Gavi support is being harnessed as well to add barcode functionality to Open LMIS and eLMIS. And in addition, the VPAG has created a guidance document for implementation by vaccine manufacturers. So looking forward, these are some of the areas that we're continuing to work on. We're definitely hoping to expand the barcoding work and provide some advocacy and some further guidance around that. We're also continuing to work on packaging, the few aspects that are highlighted here. And we're making a foray into beginning to consider work on delivery devices, particularly those delivery devices that are combined with a vaccine product, such as microneedles or novel primary containers. And most importantly, we'd like to encourage TechNet members to engage with us in this work, especially those of you who are working in country. We encourage you to bring presentation and packaging issues to our attention if there might be ways that we could help to address those issues. While we haven't identified a formal mechanism yet for interacting with country representatives, we do hope to create this in the future, and I would just encourage you, if you're interested in this, in either providing us with feedback on issues or perhaps creating a feedback loop on new concepts or products that we're looking at. Please do contact one of the members, and hopefully we'll get something posted on TechNet soon about a more formal mechanism to do this going forward. So contact information can be found here for VPAG members, and especially the Secretariat, and also the link to the VPAG website. It's a WHO website is here as well, and you can find many of the resource documents and the generic preferred product profile in our terms of reference there. And with that, I thank you.
Thank you very much, Debra, for demystifying VPAG for me. I've learnt a lot about the detailed work that you do. So from VPAG, we're going to move into understanding more about the Gavi immunization supply chain strategy. And with that, I'd like to introduce to you Alan Brooks. Dr. Alan Brooks is a nurse by training, as well as having a PhD in epidemiology. From the United States originally, he's been working with Gavi Secretariat since 2012. He's a director for health systems and immunization strengthening. During his time at Gavi, he's filled a number of roles in policy, leading measles and HPV vaccine efforts, developing its new vaccine investment strategy, and leading Gavi's efforts to implement our collaboration with the portfolio eradication. So prior to Gavi, Alan held a number of roles, including as the founding chair of the WHO Standing Committee on Product Sustainability for pre-qualification, and working about a decade at PATH. There seems to be a PATH theme this morning. So to show us the path that Gavi is taking, Alan, please. Watch out, I understand he doesn't like standing at the podium.
Good morning, everyone. Can you hear me all right? Yes. Someone in the back say, yes, you can hear me okay? Kevin, can't hear me. Louder. Excellent. Okay. Yeah, so good morning. I have an allergy to podiums, and so I'm not going to stand behind it. I won't sit on the stage. I won't walk among you, but I will just move. I was asked with trying to give a sense of the Gavi Alliance supply chain strategy, and this presentation may be both surprising, but probably actually look quite familiar to a number of you. First, I want to begin by thinking about what it means to have an ambitious ambition. Have a vision, have a view, have a sense of where you want to go that pushes the lines. In fact, that small group that started thinking in the 1970s about supply chains, we heard about it on the first day. They had an ambitious ambition. They started working hard. When those 30 people got together at TechNet in Nicosia and said, let's do this. But they were still working in a niche. They were still working in a space that didn't have the scale. As we moved into the 1990s, there became a huge effort to focus on vaccines. And that actually was a key driver in the founding of Gavi and the Vaccine Alliance. And yet, cold chain supply chains didn't have the same profile, for some reason, weren't put on the table in the same sort of way. And really, though, the world for vaccines changed radically from that point to today. Now, another 15 years on after the establishment of Gavi, we realized, wait a minute, we need to step back. We collectively, as Gavi Alliance members, or countries, civil society, industry, and say how and what can we do differently to impact supply chains. The same way 15 years ago we started impacting the vaccine market, making it a place that really better meets the needs of countries with newer technologies and better meets the needs of manufacturers and industry. And this is, in a very simplified fashion, it's actually a 1.5 years worth of work, much of which I did not do, reflecting the key elements on the left-hand side that countries, we need to support countries to put in place in order to have vaccines that are available, potent, and efficient, and that we can help then to achieve specific improvements. That's an ambitious ambition. Another ambitious ambition was Gavi's replenishment that was just completed earlier this year. We've just beginning our new 5-year strategic period, 2016 to 2020. Our current, our last time we went out and asked for funds, we went and asked for something like $3.5 billion. We got actually a couple $100 million more than that. When we went out for this time, people said, it's a really bad market, it's going to be tough to generate additional resources, but our board chair, the alliance member, said, no, think big, be ambitious, and we actually have pledges now of almost $10 billion for the next 5-year period of time. That's ambitious ambition, and that also brings accountability to deliver. What are we trying to deliver? We need to deliver impact, we, the collective we, first and foremost countries, but supported by us across the alliance, across the members in the room. Sustainable improvements to coverage and equity, recognizing that coverage particularly has plateaued over the last few years. Coverage of DTP, of pentavalent vaccines, struggling keeping measles levels that need to be increasing and reaching those last children. That's going to be magnified by the number of introductions, 150 projected in the next coming years. But that can also be supported by very, very substantial investments coming through Gavi's health system strengthening resources, showing there about over $200 million from proposals received already in the last couple of years. And that's the 203 that is broadly being targeted towards supply chain related activities. That's money that's aspiration, that's money that is there, that's the money that countries can use to strengthen the elements, the fundamentals that we've been talking about all week around their supply chain. Yes, 40% of it, plus or minus, going into equipment, but actually each one of those elements are things we've talked about this week about how we need to get them right in order to improve supply chains sustainably, achieve coverage, achieve equity, achieve the public health and impact goals that we're seeking together. So it's about delivering impact based upon an ambitious ambition, but that impact should be, needs to be, and is backstopped with the resources to a significant extent to try and realize that. Which leads me to then my last slide, which is about focused urgency. How do we implement, how do we take forward, again, collectively, and share that accountability and share that responsibility to align among ourselves to efficiently go towards those 2020 outcomes. And so I'll start with supply chain leadership, because actually we spent the entire week talking about each of these things at some level. The urgency is to begin a very credible track towards 2020 when countries would have dedicated and competent immunization supply chain leaders with the skills, the power, the personnel to be able to sustain, to maintain the supply chains we've been talking about today. This is the alliance strategy. This is the ambition that collectively we said we are looking to achieve. And that provides a platform for number 2, which is that all countries are using the data we talked about yesterday, to oversee and manage their key aspects of their supply chain, including availability, storage, transport, quality, efficiency. Key concepts around what it means to have an effective supply chain. And doing things the way we do it today may not be enough. The supply chains have largely been built in the 1970s and 1980s. Now is our opportunity to step back and say, is that still the optimal design? Based upon the amazing new technologies we've seen in the room next door, based upon just the new infrastructure in countries. What is a more efficient, effective design of those systems, and how do we create a space for countries to think about that? Making sure that the right equipment is in the right place. You've heard reference to the cold chain equipment optimization platform. It's one more incentive, one more leverage to accelerate and bring together the market for cold chain equipment in a way vaccines basically happened 15 years ago. Why are we catching up now? I don't know, but let's do this and let's do it well as we go forward. New money to hopefully continue to incentivize the shift to equipment that is more sustainable, has lower running costs, will better protect vaccines. And finally, to talk about a situation where countries are in a continuous improvement plan. We're learning, we're growing. Those managers are supported to move on a regular basis to identify gaps, build upon the data, and improve, improve, improve. So I think these are the themes that we've talked about. In fact, they're concrete deliverables, targets around each one of these elements for the 2020 period, for the strategy we've set there. I'm happy to make available to anyone that hasn't seen the implementation plan for the supply chain strategy, but really am pleased that we've been able to spend this week really talking together about components of those, how we move those individual components concretely forward. Thank you.
Thank you very much, Alan. The Gavi strategy is certainly one that's helping us to look systematically at the problem and to see where we can fit in. Part of the Gavi Alliance, two members, WHO and UNICEF, come together and are looking to form a hub. Often we see guidance from WHO, sometimes we see interventions from UNICEF, and I think the hub is an exciting opportunity to hear more about what's happening and what can be achieved, maybe with ambitious ambition together. I'd like to introduce Benjamin Schreiber. He's working at UNICEF as a senior immunization advisor focusing on strengthening immunization supply chain systems. He's also the chair of the Gavi Supply Chain Task Force with Alan Brooks and is also working closely with WHO on the immunization supply chain hub that he will present to us today. Thank you, Benjamin.
Thank you, Andrew. Good morning, everybody. I decided to stay behind the podium. Sorry, I'm a bit tired. I'm still jet-lagged. So, who thinks of the hub of a physical space? Just raise your arm. Anybody thinks? Yeah, 2 people only. Wow. Because we had a big discussion how we should call ourselves. The hub came up and we sticked with the name. And there was big pushback because some people thought the hub is like a physical space. Are you creating like a warehouse? It's not that, and I will show you now what the hub is all about. It's basically a collaboration and cooperation platform between WHO and UNICEF. Why did we actually create the hub? And that's we looked back. I mean, there's a lot of new energy into immunization supply chain, a lot of new actors, a lot of more money, a lot more attention. Things really changed in the last 5, 6, 7 years. And it also became with Project Optimize and the last TechNet meeting, we saw the increase in number of people participating in these TechNet meetings. There's much more attention. We actually had to turn people away from this conference this year because we were oversubscribed. This is amazing. Nobody would have ever thought that we would have achieved this with TechNet. Immunization supply chain oversubscribed. Nobody would have thought about that a few years ago. But when we reached out, WHO and UNICEF, and asked people who work in the space, they were saying to us like, well, in the moment the evidence and insights of what really works is still a bit fragmented. And the countries don't get the best possible guidance. There is definitely opportunities to strengthen coordination. Sometimes we have one person going in from one technical assistance partner telling one thing to a country, next time it's another person giving different advice. So how can we make sure that this is aligned? And we all know with more partners, more money entering into an area, there's need for better coordination. And that's important for the partners, but especially for the country. So WHO and UNICEF, we created in 2013 the Immunization Supply Chain Hub. And we want to play 2 roles. On the global level, we want to play the role of like center of excellence, providing best-in-class tools, evidence, but continuously looking at, we see new technology out there. Is there guidance yet to implement this new technology? How to build systems around some of these new technologies? These are gaps, and we need to continuously identify them in order to promote them, what evidence is there, and what policies need to change. And then towards the countries and working with our regional and country offices, and thus also with all the other partners at the country level, we want to really to support the strengthening of planning, execution, and also build capacity over time. So we've got 3 strategic pillars which we want to concentrate on. One of them is the new CEVM, the new comprehensive EVM. everybody's heard about the EVM. I will tell you now how the next evolution of the EVM will look like. Then we have a few focus topics. I will introduce you to them. And then also we want to strengthen and build a community of practitioners. And I think it's very important also to say what we will not do. There are certain things that we as WHO UNICEF Hub will really not do, and where we think other people are potentially better placed and stronger, and with whom we will collaborate. And this is, for example, UNICEF SD is really for us the agency who's in charge of the purchasing. WHO does the pre-qualification. The Gavi Alliance is really, and Gates Foundation are really good in market shaping, raising funds. We don't want to duplicate work that Alan just represented on the Gavi supply chain strategy, and we don't aim to tackle all the issues. Rather, we want to focus on a few ones. Also, WHO and UNICEF are not limited to Gavi only. We also work with countries that are beyond the Gavi Alliance. And also what we want to create is not a warehouse, a hub, where we build a parallel workforce. We remain within our agencies, we just strengthen the ties via the hub. So I'm going to go now to the comprehensive EVM. So we come now with 4 steps of the EVM. And I tell you, the EVM today, you know, we've done a lot of EVMs, we've done a lot of assessments, but sometimes we haven't done a great job in really advocating at the country level about the importance of the EVM. We haven't sometimes got the real buy-in of the Ministry of Health, of high-level people in the Ministry of Health, that the EVM is really a great opportunity to change, to identify bottlenecks and strengthen the system and go beyond just thinking about how it increases coverage, how you reduce your bottlenecks, and how you also strengthen child survival. We've done EVM assessments. We want to work on an evolution of the EVM assessment tool to incorporate some of the new ideas and new areas, also things that we learned here in TechNet. We've developed a lot of improvement plans, but these have not always, and Diana said in the beginning, these haven't been always linked to a national strategy. These have not often been funded. Honestly, quite often these have been developed and then submitted for a Gavi application. And if an improvement plan isn't funded and budgeted, it stays an improvement plan. And 3 years later, when you do another EVM assessment, you see the improvement plan wasn't implemented. And so going forward, we're going to focus far more on implementation. So this is how we view the EVM, linking up to the one EPI work plan. And this one needs to link in an overall health priority and objectives. So we cannot just think about the EVM improvement plan or national immunization supply chain plan as like a standalone silo. This needs to be linked with the national work plans and the health priorities. And putting all these puzzle pieces of the new EVM together, or new CVM approach together, isn't easy. And we are still in the moment playing around. And it sounds maybe a bit unprofessional if I say playing around, but it's a very complex. It is not easy. We are quite good in doing technical assessments, but then getting the linkage with HSS, getting the linkage to other people in the ministry, which are sometimes working in the planning and finance ministries, is not natural to us sometimes. And if we want to link the EVM to national improvement plans and Gavi HSS applications, there's a lot of work that needs to be done at country level, which is complicated and complex, and then also if we want to follow up the implementation, it's also complicated. So it's not easy. So we're putting these pieces together, and I think also reflecting on what Raja said in the opening speech, we have to stay simple. We can't over-engineer the CVM now into like a 10-month assessment period with fantastic plan which incorporates all elements. We have to still develop something which is practical, that people can execute, and don't over-engineer it. So that will be our challenge going forward, to keep it kind of simple, pragmatic, while becoming more comprehensive. So this is on the CVM. Then we went through this whole phase and looked at, okay, there's a whole things of areas of activities that we could engage in. So what are areas where WHO and UNICEF together can work and together deliver more than alone? And we identified there is, so we went through a strategy, there's a high unmet need for additional guidance in countries, there are clear gaps, there's no natural owner for certain areas, and we think that really better tools evidence could really have a big impact. So we listed a whole lot of 20, 30 focus topics, and then we reduced them down to 4, looking at cold chain equipment technologies, cold chain equipment management, temperature monitoring, and redesign a network. And we covered these topics to a big degree here in TechNet, so I'm not going to really focus into all of them. I'll just give you an example of temperature monitoring system. We showed that there's major challenges in temperature monitoring, and going forward we're going to develop new tools, new guidance. We had a breakout session here already on common data standards. New TPPs are coming. A buyer's guide will be is already there from UNICEF supply division, etc. So we are already working on implementing some of the hub activities around temperature monitoring, and more of these activities will come. And then a third pillar is the community of practitioners. And that you are here is actually, I'm not going to go through the slide, you are the community of practitioners. You are the immunization supply chain experts. You will be the ones that will in the end implement and do the change in countries. And this TechNet is also a collaboration between WHO and UNICEF, and we really want to strengthen these South-South exchanges going forward. There's fantastic pilots, but more than pilots, there's really innovative things happening in many countries from which other countries can learn. Far better than if I write at a global level some sort of 2 or 3 page advocacy brochure. If you go into the field and we do some exchange between countries and observe how things are going, we really want more of this. So what have we achieved to date? We work on the Gavi strategy, helped work with Raja on reviewing the GATE strategy, and worked on the cold chain equipment funding platform. We implement a lot of the Gavi supply chain strategy that Alan just showed. And in the CEVM, so we start working on the new EVM assessment tool. We are starting to support several countries. I listed here a few. Also some in this region about comprehensive improvement plans. On the focus topics, we shared already some of the outputs here from remote temperature monitoring workshops in Zanzibar, a workshop on independent freeze-free passive carriers that took place only 2 weeks ago in New York, and also working on redesign with AMP. Philippe Jaillard showed the evaluation that we supported, and then South-South exchange. And one example of a South-South exchange, we recently sent some technicians from DRC to Turkey to look at their warehouses, and it really changed the design of the regional hubs that DRC wants to implement. And these are things just which create synergy and are very positive. That's it. Thank you.
Thank you very much. As we've been going on our international journey, I've been looking around the room and people are full of energy for Friday, and that's really great. What I would like to do is to ask you a question. Who has had tropical fruits while in Thailand this week? Who's had tropical fruits? Okay. Who's had coconuts? Anyone been for a street group and have coconuts? Okay. I want everyone to stand up, and I want you to find a little space. This is our sort of big time, sort of waking up. Stand up, find yourself a little space.
Something you did.
To get the blood flowing,
I'm scared.
because we want to make this session count. So we're looking at global strategies.
We don't have to go further.
But we're going to change our brain and pick up a beautiful fruit of Thailand that had coconut. I want you to look at me, and I want you to spell out coconut. You ready? Using your body, so you do space. C-O-C-O-N-U-T. All right.
wondering where the coconut question was going to go.
That's a tough act to follow.
Thank you, Andrew.
So Heidi, thank you very much for going after that for our next presentation. So Heidi's worked as an advocacy and communications consultant on immunization and supply chain issues for 15 years. She's currently working for PATH, managing an advocacy project to raise global, regional and country visibility of supply chain issues. Thank you, Heidi.
Good morning. So I'm just going to briefly talk about a supply chain advocacy project that PATH is leading in its advocacy and policy team based in DC. It's a 2-year project, so it's fairly short, and we're just going to describe what it's about. So I think I don't really need this slide. I think that one of the enlightening things about watching the presentations today is how everybody really clearly understands that supply chain changes and improvements, especially to the degree that we've been talking about this week, really require sustained political commitment. And those commitments need to be nurtured and cultivated. Why? There are really significant risks, both political and financial, to adopting supply chain changes. From the most basic, or I would say easiest changes, maybe adopting some new types of equipment. You know, we've seen challenges that countries have faced, even adopting new equipment that they haven't really used before, they don't have any maintenance plans for or technicians for, to a system redesign project at the other extreme maybe, which there's no guarantee that a system redesign project is really going to work. And so I think we have to acknowledge that although the need for change in supply chain is urgent, there are significant risks involved in adopting these changes. So advocacy comes in by helping make the case for that change, helping understand what impact that change could have, and offering support where it's needed. So in that sense, we all have an advocacy role. We're all advocates. And we need to be clear about what we're trying to achieve. And we also need to capitalize on key moments and opportunities to engage with decision makers, higher level political leaders, to explain why these supply chain changes are necessary, show how they might impact larger goals, such as immunization goals, but also child health goals. Countries are really looking to partners, especially WHO and UNICEF country offices, for guidance, tools, resources, and expertise. And we need to show solidarity with countries and show that we are willing to share the risks involved in supply chain changes and support them through this process. So I think all of us, whether we work in a government agency, an NGO, a UN agency, may need to advocate within our own organizations to explain why supply chains need to be prioritized right now and link to those broader goals. So PATH is trying to shape a shared advocacy agenda. We've convened an advocacy advisory group and met in February and again in March with the partners listed here to help us identify kind of the major priority policy changes that need to take place at the global and regional levels. And we're now developing sort of an advocacy framework and messages that we can share so we can all, at the global and regional level at least, help amplify the importance of supply chain changes and kind of be speaking from the same page so we're not giving contradictory advice or messages. PATH's advocacy goal is to work with our immunization partners to raise global visibility and ultimately country political commitment for adopting supply chain changes. So our work will be focused on the global level, the regional level, primarily in Africa and possibly in Asia, And then working with the supply chain hub to help understand how advocacy, how that first stage of advocacy before the EVM assessment and during the EVM process can be used to incorporate EVM improvement plans and priorities into multi-year plans and other country planning processes so that we can share that information with other countries and see how that really works. So that's it, and I'd encourage you, if you are interested in becoming a member of our advocacy advisory group, to contact me directly. My email address is on the presentation, and look forward to working with all of you on this. Thanks.
Thank you very much, Heidi. So from advocacy, we're going to move into learning more about the Interagency Supply Chain Group. And I'd like to introduce Lisa Hedman from WHO to you. She's from the Department of Essential Medicines and Health Products. She's the group lead for Access to Medicines initiatives, previously having worked in procurement strategies for donor agencies and programs and capacity development programs in PSM for over 15 years. Lisa, what's Interagency Supply Group?
Thanks for asking, Andrew. And I also want to thank the other speakers, and I confess I was also with PATH for a number of years, so this is, I was kind of wondering if I was invited to be with this group because of that. Thanks very much, and I wanted to talk to you a little bit about this group, and I think the first question that everybody asks is, why do we need yet another coordinating group? Are we not at this point where we're going to have coordinating committees to manage the coordinating mechanisms? And what ended up happening is there was the discussion that happened between USAID and Global Fund, and they started talking about, well, what's really actually happening with supply chain? We've got a lot of supply chain stuff that's going on in immunization that's really great. We have a lot of stuff in reproductive health supply chain that's fabulous. We have, and this conversation went on where they said, but really, actually, how are we really doing? How are we doing in terms of what we're doing in terms of impact in the countries that partner with us as agencies to really make these supply chain things work? What are we doing to get medicines on these shelves for people who need them when they need them? And one of the things that came up for Global Fund was that they said, well, you know what, our on-time in full rate, which is a little bit different than the stockout rate, was actually only 36%. So even when we have a lot of resources, there's still some things that we know that we could be doing better. Started talking about what are the risks of the future. When you start looking at what is it that we're doing and are we actually hitting the mark, that's a question for today. But if you look at the question tomorrow, there's estimates out there that suggest that the global medicines market, not just vaccines, not just reproductive health, but all health commodities, and whether that's public or private sector, could go up by 5-fold by 2017. But when you look at the trend line, and it's on the bottom of that graph, that says, well, actually, what's the funding look like to come in and support that in terms of funds to actually buy the medicines and make them available? The traditional increase has been about 15% over a 5-year period. So you can see that one of the big risks that we have looking at what are we doing in terms of investing in supply chains, are those investments at risk? And actually, are we going to be able to accommodate the increase in demand from the medicines market? We know there's a couple of big gaps, and we know that there's some conversations that we probably need to have. We've all seen this picture about 1,000 times. How many people have taken a picture like this before, where we walked into a warehouse and this is what we saw? And what is that guy doing? He's looking for the fluoxetine because he is so depressed from all the chaos of programs that don't coordinate well. So when we talk about the future risks, we also have to talk a little bit about the present. The real question is, are there things that we could be doing better right now, just right now and today? What are some of the problems? One of the things we sat down and looked at is the massive proliferation of indicators. How many people have written an immunization progress report? Reproductive health progress report? HIV/AIDS progress report? TB report? Malaria report? Okay. So what happens is that we took a look at this, and there were several hundred indicators for supply chain. And one of the big questions is, of those indicators, how many of them were written before 1990? And there were several. How many of them were actually about the performance of a donor investment? How many of them were about the performance of the implementing partner? And how many of them were actually something that a supply chain program manager in a partner country could use to improve the supply chain of that country? And you found a pretty broad mix. So one of the things that we could do better right now is try to reduce that proliferation and make it more useful. The other thing that we've been talking a lot about this whole week is all the technologies that are out there. But one of the things that you see is they tend to be fragmented across small markets. And a lot of the markets that we work in are high entry in terms of cost to get into that market and to maintain it. And so what do we do about that? And what do we do about this poor guy? Like I said, he's out there looking for the antidepressants. What is it that we can do to reduce some of that chaos? And I think that spoke to some of the things that my colleagues talked about is, how many times is the system in conflict with the system next door? And in how many times is it the same person who has to work with that conflicting system? We've heard that story a number of times, but what are we actually doing about it? So one of the things we started out with was to say, well, what is everybody out there doing? And this was an informal survey, so I haven't posted the names of the agencies and how they responded, but what we wanted to know is roughly, how many projects are development agencies supporting in these areas? And there were some interesting numbers, but what was really interesting to us was a couple of them that had the lower numbers. When you look at, well, where is there not a lot of investment? That doesn't necessarily mean that we go run out and put money on it, but when you ask the question of, looking at things like decentralization initiatives, and the question of how are central medical stores coping with change and coping with the new environment, cold chain investment and the use of outsourced providers, they were actually among the lowest. But when you actually looked at some of the concept notes that were written by country partners to the Global Fund, you actually saw these were very high priorities. So it suggested a little bit that we were right in thinking that there were some problems with alignment. Not just problems with alignment across multiple groups, but even alignment problems between some of the development agencies and some of the country priorities. So how can we use this information to become better partners overall in health? Same thing happened when we looked at how does that pan out when you look at it in terms of disease area? WHO, we like to look at everything in terms of the disease and then work ourselves around that. But when you look at things like TB had a very low number of investment and non-communicable diseases had the lowest. One of the things that talks about is what are some of the future risks looking like? We've talked a little bit about counterfeiting and some of the problems in supply chain, but when you look at the fact that the essential medicines list was just reworked, it's done every 2 years, and there's a lot of cancer medicines that are on there now. They're higher cost. You start putting medicines like cancer drugs into supply chains, and what happens? You do increase the risk of pilferage and counterfeiting. It's a lot more interesting of a market. And when you see that there's very little investment in making sure that those drugs are managed in the supply chain very well, we know we have some risks that we need to be dealing with that we might not have thought of before. So the Interagency Supply Group has a vision statement. I think I've printed out some copies so you can pick that up. I won't read it to you, but it's mainly donor agencies and UN agencies trying to work together, and it's an informal group. It's, I think we've been accused maybe of being a Freemason society. There isn't a governance structure yet. It's really an informal conversation to help align those investments and to make sure that they're strategic. One of the things really is to look at not just talking at that global level, but actually walking the talk. When those agencies that work together in the Interagency Supply Group find themselves with a country partner, particularly if they're in the country with that country partner, to walk the talk and to make sure that there's resources to promote that type of coordination and alignment in countries. Everybody talks about coordinating. We all want to coordinate. We all want to collaborate. And we all talk about it like it's a 5-minute phone call. But we know that it takes months, it takes resources, it takes a lot of time, it takes a lot of initiative and a lot of will. And so if that group is going to walk its talk, it does have to make sure that that type of support and incentives to do that are actually available through the mechanisms that fund country programs. The ISG doesn't have a formal mechanism for its governance or for funding, but it does identify projects that it likes to work on, that it's been working on together. And some of them are actually projects that have been discussed by my colleagues. The overall goal is to make sure that we're moving up that ladder to reach universal health coverage. I know supply chain can't do that by itself, but it's certainly part of that pathway to get there, starting with the enabling environment, looking at all the work that we do together in system strengthening, and also looking at operational efficiencies. It's not just some of the big picture questions. It's how do we actually operationalize that. Some of the programs, some of the activities that, again, I think I mentioned that the ISG is not a funded entity. It's not a funding entity, nor does it have a funding mechanism attached to it at all, or a governance structure. But it's been talking about different things that it can do together. One thing that was actually quite successful, and I don't think there is anybody here from the RMNCH Trust, which is housed at UNICEF, but they have offered and have been serving as the secretariat to the ISG for the last year. And they actually coordinated a series of meetings to actually go through that process of asking agencies, could we please reduce the number of performance indicators, reduce the reporting burden, and let's actually take a stab at trying to make it more relevant. And so that was actually accomplished, and it went back to all agencies with a request, could you please consider implementing this? Could you please consider integrating this into your program so that we can actually work together, have data that works interchangeably, and not have so much burden on the same person to do 25 different reports. So actually trying to do something and walk that talk. A couple of the other things that are going on, and you're kind of asking, so when are we going to get to the point about immunization? What is she doing here talking about medicines? One of the things that's pretty clear is that there's fabulous assessment tools out there for immunization, and there's also some great ones out there for medicines. So talking about trying to turn those into joint tools. Those are discussions that are going on among the ISG partners. Gavi is clearly part of that group, so is WHO and UNICEF and other partners that work in immunization. So how can we actually use our combined systems and our combined resources to avoid the situation that I saw a couple of times in a country, I can't remember which country it was, but I remember walking in and walking past this door, and the title of the person on the door said assessments coordinator. So you can see that when we have somebody whose title is assessments coordinator, we know that assessments are probably getting a little bit out of control, and that we're not necessarily doing a very good job in making sure that when those assessments happen in partnership with the country, that they don't happen 10 times over, and that the information is being used well and that it's relevant. So there's a number of different activities that are going on in a number of different countries. Those are two of the big priorities. The next one is to try to link with some of the things that Debbie was talking about in terms of barcoding, to make sure that we've got alignment across agencies and that we're supporting those initiatives. So that's really the update for now. There's a printed copy of the update of what we're doing, and I think the mission statement's included with that. And with that, I think it's fairly clear what our objectives are to make sure that that alignment stays active going forward, and that that alignment actually fans out into some of the country programs and the country partnerships that we're all participating in. And so with that, I want to say thank you, and I also want to acknowledge again the RMNCH Trust that's housed at UNICEF that's actually been serving as the secretariat for the ISG. So thanks again for that, and thanks again for the coconut exercise. You had me a little bit scared there, but it was great.
I think there's no doubt that the supply chain, the health supply chain particularly, is going to be vital for universal health coverage to be achieved. It's very clear that the immunisation supply chain is a key subcomponent of that, and it's also very clear that internationally there is a large range of global vision strategies that are coming together to try and enable that. And we're entering an era of increased cooperation and coordination with lots of promise of results. We're going to go into a moderated discussion shortly, but because of the excitement I can see in your eyes, what I'd like you to do is turn to the person next to you, and I would like you to tell them in 45 seconds what is the key message that you've heard so far today. After 45 seconds, I'm going to ring the bell, and then your partner can tell what their key message is. So, what I'm going to ask you to do in a moment is to turn to your person next to you and tell them or discuss what was the key message that you found today, and then I get you to swap. Your time starts now. That means it's time to swap and listen to your partner's message. Thank you for participating in that exercise. By the energy in the room, I can see that there was something in the talks so far this morning that's got your attention. Always dangerous giving you the opportunity to talk amongst yourselves. I'll draw your attention back to the chair. So in our 5 presentations this morning, we've gone on a journey, as I've mentioned. We've understood VPPAG a little bit more and the role they play in the standards around packaging. We've been introduced to the Gavi supply chain strategy and that integrated approach that is looking at data, leadership, equipment, continuous improvement plans, and system design. We've learned a bit more about the hub, about 2 of the leaders in this field, WHO and UNICEF, which many countries look to, going into an era of improved cooperation for the benefit of the countries. We've heard that advocacy is going to be a key component moving forward, and we're pleased to hear that PATH is taking on a role of coordinating this advocacy together. And then you may have even got some hairs on your back of excitement raised to hear that the international donor community is taking increased efforts through the supply chain interagency group to increase coordination. I hope that has produced some questions for you so we can continue engaging in this conversation just now. And I want to come back to a comment I said before, and that is, how can these initiatives and our engagement with those initiatives increase country engagement? And with that, I would like to open the floor. I'd like to invite you to come to one of the microphones. Please introduce yourself, and just a reminder to keep your question or comment short and sharp. So please, I'll open the floor. You're welcome to stand up and come to the microphone.
Yeah, I keep short. Just want to echo 4 points I think already emphasized by today the presentation. The first one is about, because it's very clear, so many things to do. So the question for country, where to start. So I want to highlight one thing is we want to see the strong element prioritization in either EVM improvement, other improvement plan. We need to figure out what to do now and the future. Otherwise, we just lost. The second part is want to emphasize again the urgency. Get the right people to the right place in order to get the other 6 right. So that's need a lot of push. The third is about alignment, collaboration of the partner at the country level. I think we all know the concept, but in reality, a lot of competition about the partner in the country. So we need to do this, how make this really happen. Otherwise, we waste our energy. And finally, I want to highlight one thing, is the last mile. Not today, but I heard the last mile, I understand we mean go to the health center, health facility, but don't forget the last mile to reach the last child.
Thank you. So please, if you have a question, feel energetic, stand up and go to a microphone.
Yes, I would like to talk about human resources. We talk a lot here about human resources, but when it comes to concrete activities, that's a problem. We went to create Logivac, and we went there, and after 1 year of training supported by partners, we abandoned that to the Institut Régional de Santé Publique to run by themselves. And the quality is going down. And we abandoned that to run, we go to East Africa, to Rwanda, to start something similar. I would like us to be more consistent. If we start something, we support until we are sure it is rooted down so that it can run sustainably before running to go and start something elsewhere and drop that after 1 or 2 years. The second thing I would like to draw the attention, I was paying attention to the list of countries. Each time the list of countries appeared, it's always Uganda, Tanzania, something like that. And sometimes Senegal drops in. And we are surprised that Ebola starts in Guinea, Liberia, Sierra Leone, where we're not doing anything there. So we have to be more systematic in our coverage of the countries, not go where the low-hanging fruit to catch. Go to Chad, go to Niger, go to countries where problems are very crucial to do something sustainable there.
Thank you. Thank you very much. Please, you don't need to wait for someone's question to finish till we go to a microphone. You're welcome to come and stand at the microphone as you have a question so that we can keep the questions going. We'll take 2 more questions and then we'll do a round of answers across the panel. So please come to the microphone. Or the microphone might come to you, yes?
Just to, is it on? Can you hear me?
Yes, I can now.
Okay. Just to enlarge on what Mojtaba was saying, I think there's a problem linked to the training of logisticians. And that is the stature, the accepted, let's say, power of the person who's being trained to actually start to make decisions in the health system. Logistics has not had a high profile. It's been junior. These logisticians, however well they're trained, come out with an obscure and new kind of certificate of logistics. Unfortunately, they then get plugged into the health system where what's needed is a strong management of logistics. And unfortunately, they don't have the stature or the power to do that. So I think some thought should be given to the existing cadres in the Ministry of Health, particularly the pharmacists, who already have a stature in the health system. And it should be they who actually steer the logistics power to serve the needs of the health center. And I would have said the other half, but there's not time.
Thank you. So we're warming up, so we'll take 1 more question, then we'll do a round of answers, and then we'll go again for another lot of questions. So please, sir.
I'm Tiki Robenheimer, consultant. A lot of the donor funding projects, if not all, are managed on an annual, 2-year, 3-year basis. We seem to be short-term driven for results, whereas a sustainable supply chain is going to take a lifelong commitment. And we find a lot of projects starting up, data collection starting up, and when the project closes down 3 or 4 years later, that is the end of that infrastructure and intellectual property. What is being done at global level to ensure the sustainability of these human resource initiatives we talked about this week, the data initiatives, the equipment initiatives, the maintenance of those? Thank you very much.
Thank you. An exciting initial round of questions. Debra, I'm going to invite you to start and then just to come across the panel to address any of those questions as you feel appropriate. Any comments you'd like to make there? Okay, so Alan?
I actually wanted to jump in on the last comment, which ties into a number of the pieces. So Gavi came into existence in the late 1990s, early 2000, and it was because the international community, as many of you know, coming out of UCI, et cetera, was sort of in a plateauing, stagnant space. Sense that there needed to be a rebirth, both in terms of investments and commitments and direction, alignment, et cetera. At that point in time, the Alliance took some fairly bold decisions, and it got some of them right and some of them either less right or just less clear. One of the decisions it took was in relation to its vaccine support. It said we're going to do new vaccines, we're going to do it in this way, and we're going to do this is the basic architecture. And it's basically followed that model for 15 years. And if you recall, the slide, one of the slides I showed, shows the crazily large number of introductions that are going on. That's a product of a cumulative, steady direction. Some bends in the road along the way, yes, but essentially a steady stream of support, direction, investment, messaging. I would say that the international community's investments in health systems, the immunization communities in health systems, and more specifically, the immunizations community's investments in supply chains haven't had the same sort of consistent view over not 1 year, not 5 years, but over the 10 to 15 to 20 years exactly to get at those kinds of changes around leadership, as John and Mojtaba were talking around the pieces of these elements. Now, that's by saying urgent, there needs to be a focused urgency to get going, to get this rolling. That's not short term though. This is focused urgency. It's taking the lessons from polio that you have a long-term goal, but you work intense, you work hard to get it, and you do that though over a long period of time, and that's the commitment we need to make. Gavi did a modeling exercise recently and said, how quickly could we work ourselves out of business? Asked that question before we went and asked for the $10 billion. When could we be out of business? Actually, if you do the math in terms of how countries' GNI is increasing, still, even out of the 2035 period of time, there are countries that would be still within the Gavi threshold of eligibility, which means that we should be taking a long-term view to how do we put sustainable challenges in place and solutions in place, and then work towards them. Get on with it and work hard.
Benjamin?
I'm going to answer to 2 points linking to service delivery, and I think reflecting in this TechNet, we didn't address the linkage so well, I think, between immunization supply chain and the link to service delivery. And it makes me wonder if we're just trying sometimes, do we see ourselves again in a silo? Are we just creating our new own group of immunization supply chain specialists, but we don't talk anymore to the immunization program? And then, so it's something we have to just think more about this link, because the immunization supply chain is not an end in itself. It is there to deliver vaccines that are available and of quality and then being actually used. So we have to think about linkage to outreach, linkage to other service delivery services. So I think this is a very good point, Xiaojun, and I think we have to work more on that. All the points about recognition of logistician and HR. Last TechNet, Mojtaba, you brought up the very nice hourglass of where the attention is. It was a great presentation. But I think we also have to look just amongst ourselves. I sometimes get addressed, hey, you work in CCL, right? I say, no, immunization supply chain management, it's a more beautiful term than CCL, because the other person says, oh yeah, you're the guy who fixes fridges, right? And that's how we sometimes get seen. It's like very much the technicians. And it starts in our own organizations that immunization supply chain is kind of not actually often recognized. The link then to the more beautiful service delivery and epidemiology sometimes is not so clear. So we need to work there. And so one thing I just want to inform everybody about, WHO and UNICEF is working on an e-learning platform or e-learning course that will be an e-learning initiative which will train all of our staff in immunization supply chain, amongst other issues like communication for development and just basics in immunization. So there's work ongoing, and these e-learning modules will be launched. And then at the country level, I think we are doing too little to really professionalize and work on the recognition of immunization supply chain, well, not immunization supply chain, actually not health supply chain managers as a profession in the ministries. There's too little, there's a lot of discussion, but I haven't seen many countries in the last few years recognize this as a profession in a country. So I think there's still a lot of work to be done. That's it, over.
I'll just comment briefly on the, Tiki, your comment about donor projects being too short-term. I couldn't agree more. And I think that for organizations that are like PATH, who kind of live on these short-term contracts, you know, we try to look for ways to make the work more sustainable. So, for example, when we're working in Senegal and Uganda, these donor darling countries, I think that we're looking to kind of incorporate mechanisms that can continue on. You know, whether it's as you know, if we can achieve a supply chain working group that functions beyond when our funding ends, I think that's the type of thing we're trying to look at. But I think we're talking about a bigger systemic issue that needs to be addressed. And then, Mojtaba, I think your point about working in countries where the problems are really serious is a great point. And yeah, I agree.
Mojtaba, I think that you hit a hot button here because everybody's commenting on your comment, and I'm going to join them. I wanted to just make a reflection. You know, when you think of the industry that, how many people flew here? Pretty much everybody except for people who are from here, okay. And you're aware of the fact that air traffic control controlled the plane that you took off from and controlled when and where and how you landed. And that's a protected industry. And most countries protect their air traffic control industry. It's highly regulated, it's highly valued, it's highly controlled, and it's highly acknowledged. And I think we all get why that's happening. It's pretty important that we do that both from just from a safety standpoint, but also from a security standpoint. And I want to just go back to one of the small points that I made when I was talking about supply chain risks for the future. When we start looking at new drugs in the pipeline, particularly drugs and vaccines that are high value, we're moving into a new realm where we're going to be opening up supply chains to higher levels of pilferage, counterfeiting, and other types of not legitimate activity. And one of the things that's actually imperative about making sure that leadership is there is actually managing that. If we don't start acknowledging a need for leadership, and don't forgive me for saying this, but I think a lot of our brothers and sisters working in supply chain are very educated people. They're not, and I shouldn't compare them to the educational standards used for air traffic controllers, but I would have a hard time saying one is lesser than the other. They certainly are people who have equally important jobs and equally important roles to play. But if we don't start doing something about the leadership and about the way we manage that, we are opening up a fairly significant risk. And so I think one of the ways to promote this issue of the need for leadership is to hit that risk button a little bit harder than we have been, and to start recognizing that if we don't do that, we are going to face increasing levels of non-legitimate activity in our supply chain, whether it's criminal or unintentional. I think both will probably go up. And I also want to speak to the point, I think, when Heidi referred to some countries being known as the donor darlings. When you create a darling, you also create a massive amount of inequity. And I want to take us back to immunization that we did in the H1N1 pandemic. And one of the things that happened was we had a lot of demand for those vaccines at first and not a lot of supply. And so one of the principles that was used in deploying from a global level a certain amount of vaccines to try to control that pandemic, fortunately it wasn't as serious as people expected, but one of the principles was to say, well, if a country isn't ready, and being ready had a definition, then let's move on and give the vaccine to the next country because we don't want to give a limited supply to a country that's not ready. Well, where did that readiness come from, and what kind of darlingship program made that happen? It can actually lead to some severe inequity. And so I think one of the things we have to ask ourselves is when we're looking for equitable access to medicines, are we actually creating an equitable system, or are we creating a system that's more politically driven and that actually leads to greater inequity? So it's a question that I think has to go back to the donor funding community to see what is it that we can do about that, and make sure that when we talk about universal health coverage, that we actually mean everybody, that we don't just mean certain countries at certain times, because we know that in the end, that doesn't actually work. So thanks for letting me comment on those things.
Just before we go into the next round of questions, there will be one more round of questions, so get ready, put your hand up if you want a microphone. There are 2 lined up already. But I'm just going to put my People That Deliver hat on just for a quick moment, even though I'm not sort of on the panel but chair, just to note that working with Masunda, who is from UNICEF, with the People and Practices Working Group, and one of the activities we're looking at is a landscape analysis of up to 15 countries, including the enabling environment. And part of the enabling environment is, where do the supply chain leaders fit in that environment? Where do they need to be in order to be part of that political landscape to make change? So we hear that point, and we're looking at that from that perspective. When it comes to advocacy, we're working with PATH to see if we can get that HR piece as part of the advocacy package. And for all of you people in country, don't forget the HR package we gave out yesterday. There's a whole bunch of human resources advocacy tools in there. And with that, we're going to go to our second round. Dorothy.
Yeah, good morning. Good morning, and thank you so much for the presentation this morning.
Can I speak?
Yeah.
Could you please have people stand up so we can see those?
Yeah. So we're just going to swap microphones. And Dorothy, if I get you just to stand up so we can see you.
Yeah. Good morning. Thank you for the presentation this morning. It was very interesting. I would like to raise a concern regarding the coordination framework and how to improve the coordination. I think that there is already the International Health Partnership Plus, the IHP Plus, which is, I think, a cross-cut group, which is really focusing on how to improve the aid effectiveness among the DPs, the development partners and the donors in countries. So I would like to know how far, TechNet and all the partners are moving into this process too. It's really for the health sector. So I assume that supply chain management should be also part of this. And at country level, I think that there is a weakness. I think we don't have any champions or advocates among the DPs, among the development partners, to really promote the needs for supply chain managers or leaders or whatever. So what would be the modus operandi for doing that? Because we know that in this kind of meeting we agree on that, but what happened in the country, this is so different. So what would be your recommendation or mechanism for that? The second point is related to the graduating countries. So there are, I think, around 20 graduating countries, right, from Gavi support. I would like to know what is currently the strategy or the action plan of Gavi to provide special support to these graduating countries for strengthening supply chain management and really, consider the upcoming supply chain risk, increasing with the increased number of vaccines, the cost and all these things. So I would like to understand better about this. The last, and always the same point, sorry for that, Andrew. What about Southeast Asia? When we look at the list of the priority countries for the Gavi supply chain management strategy, no Southeast Asian countries. Why? Why not Myanmar? Why not Laos, why not Vietnam? Why not Cambodia? So I think that there is still, something unfair to me and as an INGO, we need to raise the voice. This is unfair. Thank you.
Okay, thank you. We have the final queue of questions in line. 3 to go, short and sharp.
Thank you. Just
please stand.
Two quick questions, but I don't expect answers.
Big voice.
So one is, in terms of global, where do we put the beneficiary? I mean, we are talking on behalf of those beneficiaries for whom we are working. So I think sometimes it is good to think out of the box that initiative, for example, environmental, global warming, and so on. We have to put them up front so that they are also, sometimes they are sitting with you there. The second one, my understanding is...
I'm sorry, I didn't understand.
The first one, what I'm saying is, this is global initiative, and we need to put those beneficiaries, we think that they are going to benefit from global initiatives, that they are also thinkers and doers. So the more engagement of those countries who are we are working on behalf of them. The second one, I feel a little bit, you have a dream, we have a dream, and always when I was a child, when they ask me, what do you want to be? I want to be a runner. Who is? I say, Haile Gabriel, something runner. For those countries, we are not putting those developed country experience. Where are they? No sharing about them. Where are they? What did they did so that we are learning and to say, oh, we want to reach here and there. Thank you.
Okay, thank you.
Okay. Yes, it happened to me to visit a country in 2004. And in that country, there were 2 logisticians in 2004. In 2015, there are still 2 logisticians in that for the vaccine management. And since then, 4 vaccines have been introduced in the country. I'm giving numbers. And their monthly salary is $200 per month. They are managing 50 million US dollar. Let us think about it. And is why I want Heidi, for example, for advocacy, in fact, to insist on that aspect of human resources, because I think it's not normal, the numbers that I just gave you. 50 million for $200 US a month for 2 people to manage, and it's unacceptable. The other number I want to give you is the bureaucracy of doing the same. It happened to a friend of mine, Marie Traore, in DR Congo. For each round of vaccine of polio campaign, we were hiring bicycles, $5 per day. 5 days, $25. 3 times, $75. A bicycle costs $60. Less than the 3 months. So, and we was keeping doing that the same for long. What he decided, fortunately we had a good WR who wanted to go beyond that. So he bought 5,000 bicycles for $300 US, and not only for that polio campaign of that year, but people use the whole year those bicycles for surveillance of IFP, and the following year they use it, and the deal was after that this bicycle will belong to them. So
I need you to
2 rounds and motivation to the people also at the same time. Thank you.
Okay, thank you. And our last question, panelists, I'll get you to think about your key message that you would like to share with us, keeping in mind this last round of questions. Hamedo? Sorry, I thought you had the mic ready.
Well, thank you, Andrew. It's Hamadou. You always
Hamadou,
make the
my
mistake.
apologies.
It's the you, not Hamadou. Just 2 comments and no question. I just would like to acknowledge the work that VPPAG has been doing, in really, because your work has a lot of impact on the work that we do as supply chain. So I just wanted to highlight that, especially the small formulations and vaccine sizes, and now the new UNICEF that has been PQS. So just wanted to acknowledge the VPPAG excellent work. And my comment is for Heidi. I think it was about time that we have experts coming in communication and advocacy, because if you look at our messages, have always been about changing people. And if you want to change someone, the person will resist. No one will resist change, but the people resist being changed. And I think having your expertise in this project, so I hope that at the next TechNet, you will be able to show us what progress has been made thanks to your advocacy skills. Thank you.
Thank you. So we'll go with Debra, and coming along, key messages from the panelists as we close.
Well, I feel as though the questions were very much directed mostly towards Gavi and UNICEF, and one for Heidi, so I will pass again.
Okay. Alan.
Thank you. A number of questions for me, and then I'll pass it down the road. The first question was in relation to alignment with international sort of best practices, and specifically the international health partnerships, IHP Plus, aid effectiveness principles. The Gavi Alliance is actually a signatory to that. We are reported on, accountable through those mechanisms, and we absolutely do have this as one of the lenses when we consider anything we do. So for example, we've heard some discussions about the establishment of a cold chain optimization platform. There's a number of different ways that we could put additional resources into the cold chain space to incentivize new technologies and to create space for countries to adopt those. And in fact, one of the key starting points is how could we do that in a way that maintains adherence to key principles, like that it be country-driven, and that there is a sense of ownership and alignment at the national level within national plans, et cetera. So I think that those are part of our DNA and continue to be things that we look forward to. So question on graduating countries. Just for clarity, so everyone knows, Gavi supports countries that have a gross national income per capita of, it's about $1,560 or so currently. It's based upon the World Bank calculations, and so it moves every year. And as countries move above that level, then Gavi basically provides 5 years of transitional support to those countries. And during that period of time, the types of engagements really are intended to create let's say a softer landing pad for the phasing out of Gavi's support, both the vaccine side, but also increasing and reinvesting in the programmatic aspects, the in-country coordination, the regulatory and other aspects that the country identifies as being potential bottlenecks to having a more sustainable, longer-term systems in place. Again, to reference the platform, but also the vaccine side, while Gavi can't provide vaccines for countries after they graduate, what we have been able to do is negotiate with manufacturers to ensure that those graduating countries have access to the same prices Gavi pays if they want to, and we hope will continue to use vaccines after they're out and no longer being supported by Gavi. And we hope to do the same thing in relation to supply chain. So right now, we're at a space where prices are negotiated through UNICEF. We believe that Gavi will increasingly get a preferential price, given that we are providing to a very special part of the world, and that we hope that as countries graduate, for example, they would continue to benefit from the same price as essentially Gavi countries would in order to create that kind of space. Recognizing that the commodity is only one element, I think the technical assistance, the thinking, the planning throughout their graduation period needs to be focused and needs to reflect where they want to go and what they need to be in that end period of time. Recognizing that for some countries it's very, very challenging. A country like PNG has many challenges, and neither 5 years nor 10 years maybe will be sufficient to solve all of those. Yeah. One comment on sort of the specificity in terms of Gavi's strategy. In fact, the supply chain strategy is a global strategy. All countries around the world are anticipated to be targeted, and there is a sort of a triangulation based upon where we understand countries are at from some ongoing discussions. As we go forward with the new 2016 to 2020 period of time, there is going to be an increasing amount of discussion and dialogue at the country level about how Gavi's technical assistance resources will be provided or programmed, let's say, against the country's own annual work plan. So we're in the process of turning the model of providing support somewhat upside down for technical assistance, et cetera, which is kind of complicated and will lead to some challenges, but we hope that the resources will be much more closely aligned against the country's annual work plans. So the call is do annual work plans, articulate in those the supply chain needs, so that then we can concretely invest against those as we go forward.
And we'll need to move along, Alan.
That's all. Okay,
excellent.
I'll stop there.
Thank you for those messages, Benjamin.
I'm going to follow on what you just said. Because how do you articulate these needs? And that's where the EVM is really useful, because the EVM is an evidence-based assessment of your bottlenecks